Okay, you are now officially live.
Well, good morning and welcome. Welcome to the Health Equity and Access Response Team. I am Dave Roth. I will be our guide through this morning's agenda. First, let me share some things about this meeting. In a couple of minutes, we're going to do introductions. It will help if you have your attendance list in hand. That was sent to you last night. It's not absolutely necessary, but it will help the process. About this meeting, as you can see from your screen, we are recording the meeting. This will allow members of our group who are not present to catch up and stay up with us as we move forward. We are being live streamed, and that means that we're doing two things at once. We're building a team among the members who are gathered here, but we also are being transparent to the broader community about our deliberations. As this is a Zoom meeting, you have control over your audio and your video, and I ask that you mute your audio except when you're speaking. In terms of video, I want to encourage you to keep your video on as much as you are comfortable doing this. This will help us get to know each other. You all should know that most of us don't know most of us yet. This morning, we have 4 objectives. Number 1, we're going to get to know each other better. Number 2, we're going to achieve a common understanding of the impact of COVID-19 in DuPage, deconstructed by race and ethnicity. Number 3, we're going to understand a proposed framework for improving equity, knowing, however, that the best framework is going to be the one that we will work out together. Fourth, we will identify actions that we can take individually and together. Now, I'm going to ask you to pull out that attendance list if you have it, and turn on your video if you are comfortable doing that. And we're going to do some introductions. Now, we are fortunate to have with us today, this morning, some whose names did not get onto the list. Thank you for being here. When we complete the list of those who are named, I will go back and ask those of you who have not yet introduced yourselves to please do that. So we'll all know who's here on the call. So what I'm asking of you in this introduction will take you about 1 minute and maybe a little bit less. And here's what I'm asking of you. That would be your name, your organization, a bit about what your organization does, and a bit about why it's important for you to be here. So I'm going to show you this by example. I am Dave Roth of DuPage Federation on Human Services Reform. DuPage Federation is a planning council for human services so that the system of services is effective and all our neighbors have the opportunity to prosper. We are here because our system of service has disparate outcomes for neighbors that are related to race, ethnicity, culture, language, and immigrant status. We as an organization and a community will never achieve our goal of an effective system for all until we address the actions, the behaviors, the habits, the structures, and the systems that result tragically in outcomes that are ethnocentrist and culturist and racist. So now I'm asking you to also introduce yourselves. And I would like to begin. So if you have your list in front of you, we're going to begin at the top in the alpha with Dr. Aitken, Karen Ayala, and Dr. Asfar. And I wonder if I could ask you to come to the mic and introduce yourselves.
Should I speak, David?
Let's see. I think Dr. Aitken may not be with us, so maybe we'll go Karen and then Saima.
Sure. So my name's Karen Ayala. Thank you so much for being a part of this conversation this morning and this response team. I am the executive director at the DuPage County Health Department, and health equity and disparity is something that's central to the work that we do. Thank you. Dr. Asfar.
Thank you. I'm Saima Asfar. I work with Islamic Circle of North America Relief, ICNA Relief. It's a local social service organization. We have many projects and programs. We have a hunger prevention program with 2 food pantries and multiple distribution locations. We have a transitional housing for women and children in the DuPage County. We have a case management program with different services, for example, car donation, ESL, counseling, and more. Then we have a telehealth service, a helpline, and we are planning to start a telehealth clinic. We have a mobile clinic through which we do health screenings. And there are many other. We serve 14 nationalities, and our staff speak 8 languages, and most of our work is done through volunteers. Thank you.
Thank you. The next 3 I'd like to invite are Greg and Laura and Regina.
Good morning, everyone. I'm Greg Bedlove. I'm the president and CEO of Choose DuPage. We are the not-for-profit 501c6 that supports economic development efforts throughout DuPage County. Happy to be with everyone this morning.
Good morning. Laura, are you with us today?
Yes, hello. Sorry, my camera doesn't work. I'm figuring that out, but I work with Catholic Charities. I specifically am in the immigrant support program, and we help with education, referrals, and some direct assistance to immigrant families. And then Catholic Charities as a whole has a lot of housing programs, a homeless shelter in DuPage, and emergency services for people who need rental assistance or basic needs assistance. And in my specific work with immigrant families, I believe I've seen a lot of the disparities that are happening in our county. So I'm happy to be here to talk about it and to see what we can all do.
Good, welcome. Regina, are you with us? Reverend Miguel? Heather Britton.
Good morning. My name is Heather Britton. I am the McKinney-Vento student advocate for DuPage County Regional Office of Education. And my job is to work with families that are in transition, homeless children, to make sure that they are in school. And I train schools on homeless law so that they are aware of what resources they can provide to the children.
Thanks, Heather. And to those who've just joined us, we're doing introduction with name, organization, a bit about your organization, and what brings you to this group, hoping you can do this in less than a minute. And we're working our way down the alpha attendance list that was distributed last night. And when we get to the end of that list, we'll invite those who are not on the list to introduce themselves. So next would be Michael Childress. Dr. Rushmi, do you mind introducing yourself here? We'll give you another one in a minute.
Yes, thank you. Good morning, everyone. My name is Rushmi Chugh. I serve as medical officer at the DuPage County Health Department. I am board certified in family medicine and have had the privilege of serving at the health department since 2003. And as Karen mentioned, we are involved in and very interested in engaging further in assessing and monitoring the impact of COVID-19, particularly with respect to health equity and access, and hopefully going forward, continuing to monitor our progress in addressing these disparities and inequities. Thank you. You'll be hearing a little bit more from me soon. Thank you.
Thank you. And then I'd like to invite Dr. David DeRamos, if you're with us. You may not be this morning, so
he had patience. He sends his apologies, and we'll try to get here for future meetings.
okay. So then invite Jennifer DiCostanzo.
Hi, yes, I'm Jennifer. I'm a social worker at the VNA. We, of course, provide all different health services to vulnerable populations, but also to people who are privately insured. I'm here because it's a new initiative at the VNA to look at social determinants of health. And so I'm actually fairly new to that organization, but I'm happy to be here. Thank you.
Thanks. And I invite Nicole Edmonds.
Good morning, everyone. My name is Nicole Edmonds. I am the Central Chicagoland Regional Director for Community Health for Advocate Aurora Health. So I oversee the Community Health Department for Good Samaritan Hospital in Downers Grove, for Illinois Masonic Medical Center in Chicago, and also Lutheran General Hospital in Park Ridge. And I oversee the Community Health Needs Assessment and also the Community Health Improvement Plans for each of those sites. And so a lot of our strategies within the community health improvement plans really revolve around addressing health disparities. So really happy to be here. Thanks.
Very good, thanks. The next three are Adam, Theodia, and Pastor Al. Adam, can I invite you?
Yeah, hi, I'm Adam Forker. I'm the Director of Client Access at the DuPage County Health Department. And I'm here. It's well known that health disparities, social determinants of health, are a core public health issue. It's very important to us as an organization. And personally, I would just add, I live in DuPage County. I love DuPage County, and I believe it will be its strongest, most successful self when we effectively deal with health disparities. So thank you. I'm very excited to be here.
Thanks, Adam. Theodia, are you with us? Pastor Al? All righty. Then the next three I'll invite are Janice and Phil and Chris Hoff. Janice, welcome.
Morning. I'm Jan Geider. I chair the Health Committee for the DuPage NAACP. And as most of you know, our mission is to secure the political, educational, social, and economic equality of rights in order to eliminate race-based discrimination. The Health Committee in particular is looking at bringing some equity to healthcare here in DuPage County. And we are currently working on two significant projects. One is addressing diabetes through COVID-19, and the other is helping to broaden the access to healthcare through telehealth and telemedicine. And thank you for inviting me to be part of this much needed effort here. Thank you.
Thanks. Phil.
Good morning, everybody. My name is Phil Gipoko. I'm the Community Impact Director for the American Heart Association. Our mission is to be a relentless force for a world of longer, healthier lives. And while we still focus on cardiovascular disease and stroke, we've expanded our work into other issues, equity issues, social determinant health issues, to really expand those lives. The American Heart Association is working with researchers, medical experts, community members, businesses, families, to reduce the impact of coronavirus. We're investing dollars into COVID research. We're providing resources for community and healthcare providers to administer CPR safely during this time. We're working with parents and teachers to keep kids and families healthy during the time, especially while kids are away from school. And we're providing businesses with essential resources to help their employees stay healthy during and active during our corona period. The American Heart Association has also launched a Don't Die of Doubt campaign. It's a national campaign to remind individuals to continue utilizing our emergency rooms and hospitals during cardiac or stroke emergencies, and to continue sharing that message that it is safe to go there.
Very good. Thank you. Chris.
Yeah, good morning, everybody. My name is Chris Hoff. I'm the Director of Community Health Resources at the DuPage County Health Department. Hopefully you've seen some of the work we've been doing over the past 9 months somewhere, I hope at least. And I'm here because I think all of us, and certainly myself, have been impacted by coronavirus in some way. But as we look at the data and what we know about the impact here in DuPage, we see that many are impacted much more significantly than others. And so we want to look at strategies to help everyone be safe and be able to have the opportunity to be healthy.
Thanks, Chris. And the next three I'll want to invite to the mic are Linda Jackson, Rima, and Mary. Linda, are you with us?
Yes,
Hello.
yes, I am. Good morning, everyone. I'm Linda Jackson. I am village president of Glendale Heights. I have no medical background, but I do have a very diverse community, and our COVID numbers are very high. We are working very hard to straighten everything out, and I would really like to be part of making things better and give equity to everyone when it comes to medical treatment. Thank you.
Thank you. Rima.
Hey everyone, it's so nice to be with everyone today. My name is Rima Kamran. I am the Executive Director at the Illinois Muslim Civic Coalition. Apologies, I'm calling you from the car. You caught me at my other job, which is chauffeuring people from one place to another, so apologies for that. The Illinois Muslim Civic Coalition is a partnership of activists, influencers, change makers, and organizations, and our mission is to collaborate with others and amplify social and civic efforts towards equity and representation. We are all striving for civic justice, and that's why we're here at the table to empower the voices of marginalized and often invisible communities. So we look forward to working with you all, and we worked with many of you through the census work that we were doing in DuPage to continue to bring healthcare disparities to light, as well as see how we can amplify the important work that everyone is doing together. Thank you.
Thank you. Mary Keating.
Good morning, everybody. I'm Mary Keating. I'm Director of Community Services for DuPage County. The brief description I usually give is that we are the social work and grants management wing of county government. We've been fortunate enough to be the recipient of several significant funding sources to assist with coronavirus relief and recovery. And so over the next several months, we'll be planning how we'll be utilizing those funds. Some we're using now, some are a little bit longer horizon. So I'm looking forward to the opportunity really to listen and to gather more information about where we should be going with our assistance. So thanks all for being here.
Thanks, Mary. The next three I want to invite are Kristen, Cheryl, and Mike. Kristen, are you with us?
Good morning, everybody. My
Good
name
morning.
is Lundeen. I'm a community initiative coordinator through the health department, working in emergency leave preparedness and this month, so very heavily involved in COVID. But I've been working in the DuPage community and with the community for many years throughout my career, and have definitely seen the impacts of health disparities. So I think for us to have a healthy community, we really do need to focus on and make sure that everyone has access to the medical care that they need. So I'm excited to be here.
Thanks, Kristen. Cheryl?
Oh, good morning. Sorry, David, I didn't bring my laptop with me today to the office, so I don't have a camera, but my name's Cheryl Marquet. I am Deputy County Administrator for DuPage County, so I work at the direction of the chairman and the county board. One of my primary responsibilities over this past year has been the distribution of CARES Act monies on behalf of DuPage County, and certainly very early on, it was identified as a need to have more outreach to minority communities. So I'm here to provide whatever support you need from the chairman and the county board.
Thank you. Mike.
Good morning, Mike Marin. I'm the village administrator for the village of Glendale Heights, and I don't think I would try to say it any different than Mayor Jackson just did. So thank you very much.
All righty. Thank you and welcome. The next three I want to invite are Kara, Dr. Daniel, and Lisa.
Hi there, Carol Murphy. I'm the president of the DuPage Health Coalition. Our mission is to coordinate efficient and effective health access for low-income residents of DuPage County. So, of course, the families that we serve have been significantly impacted by COVID. It doesn't represent a new disparity. It just shines a light on the disparity that was already there. So really excited to be a part of this group. We operate a few programs people may be familiar with: Access DuPage, coordinating health access for the uninsured; Silver Access, which is ACA premium assistance. November 1st, open enrollment begins. And the DuPage Dispensary of Hope, as well as through COVID, a fairly significant flu vaccination effort funded through CARES Act dollars, and also a community face mask project. Happy to be here, guys.
Thank you. Dr. Daniel.
Good morning. Thanks for
Good morning.
having me. I'm very glad to participate in this group. My name is Daniel Perez. I'm a pediatrician working in Addison since 2010. I have a large population, mostly are Latino Hispanics, 90% Medicaid. And while I have not seen directly some cases with COVID, I think what we're facing now is the mental health implications or repercussions of the pandemic. And I think that's a big problem that I hope this work group will help address.
Alrighty, thank you. Dr. Perez, would you say that again? Your sound is a little bit muted, so do you mind? You put us a real clear directive there, and I wanted to give you a chance to say that again.
Oh, give me a minute. I'm gonna change mode of. Okay. Can you hear me better now?
Yes, good.
Oh yeah, I wasn't there. So yeah, I'm gonna do it again. So I am a pediatrician working in Addison since 2010. I have a large Latino population, 90% Medicaid. And while I have not seen directly many cases of COVID-19 because we are doing social distancing and telemedicine for sick patients, I do see on a daily basis the repercussions, so mental health repercussions with anxiety disorders off the roof. And this is an issue that I think has long-lasting consequences as well, because in kids who are in school, they cannot do school because they have this anxiety, and this, of course, has the implications are not going to be graduating, or they're not going to have the education that they need. And this, needless to say, this is something that is very serious.
Thank you very much. Lisa.
Good morning, everybody. Some feedback here. I don't know if that's just on my end or not. Good to see everybody. I'm Lisa Shabak. I am the director at WorkNet DuPage, which is the county's workforce development division. We work toward...
Yeah, I want to remind everybody, if you're not speaking, please mute yourself. Thanks.
We administer Federal Department of Labor dollars for employment and training services for the residents and businesses of DuPage County. We work toward developing and training the DuPage workforce to meet the demands of the local economy, really strive to help boost the earning potential of each and every household throughout the county.
Thank you very much. Welcome. The next three I want to invite are Member Salmon, Evan Summers, and Jennifer Trupa.
Thank you, David. My name is Ashley Selman. I serve on the DuPage County Board. I represent District 1, which is the northeast corner of the county. That includes some of our hardest hit communities, including Addison, Bensonville, and just a little bit of Glendale Heights is in my district. I've been trying to work as collaboratively as I can with my colleagues to help get programs like our flu shot program up. So I'm just here to learn what the needs are and work with Cheryl really to make sure our board can be as helpful as possible. Thank you.
Thank you.
That would be me. I'm Evan Summers, Village Manager for the Village of Bensonville. I am one of in Ashley's district, so she teed us up pretty well. Bensonville is a very diverse, proudly that diverse community, but we have been very hard hit with COVID-19, and so we're looking to ways to address that, and then just not stop at COVID-19 and look forward, so we have progress out of this. We can build back better.
Very good. Thank you very much. Jennifer, are you with us? Okay, then the next three that I'd like to invite to the mic, and we're getting near to the completion of this task, are Mila, Rosie, and Maria. And then we're going to go to the bottom, which will be Mayor Veenstra, Representative Villa, and Linda Yang.
Hi, good morning. My name is Mila Sagalis. I work at the Health Department in our Community Initiatives area, which is the kind of the landing place for many of our coalitions. I've had the pleasure of working to put this one together with Karen and Chris and Rashmi and Kristen and a number of our staff here. So I'm excited to see the number of you that showed up and are joining us today. So thank you very much. Thanks, Dave.
Thanks, Mila. And Rosie Valencia.
Rosie may need to hit *6 to be unmuted.
Rosie, while you're doing that, we're going to go on and ask, is Maria with us? I want to invite Mayor Veenstra.
Good morning, everyone. I am Mayor Veenstra. Obviously, Addison is a highly impacted community, very diverse, and we have been working diligently to stem out the growth and the spread of COVID, but it's got to be a team effort, and that's why we're here today.
Welcome. Let me invite Representative Karina Villa and then Linda Yang.
Good morning. My name is Tammy Caltadroni. I am the District Director for Representative Villa here in Batavia. It's important to the representative that we have an opportunity to hear the voices in the district and surrounding communities to ensure that we're effectively representing the people of the 49th District. Thank you for including us.
Very good. Thanks for being here. And Linda, are you with us today? Let me circle back. Rosie, have you had a chance to do that *6?
Yes. Good morning, everybody.
Good morning.
Hi, I'm Rosa Valencia I'm the social worker from West Chicago Police Department. I'm working with, even though I'm working in the police department, I'm providing a lot of community services to the community. And I'd like to be involved with this, this coalition or this group because we have a lot of needs in West Chicago. Thank you.
Thank you. I want to circle back. Michael Childress, I see that you've joined us. Would you share with us name and organization, what your organization does and why this group is important? And you may also need to do a *6. Or Penny, if you have other advice, that would be helpful too. While we're looking.
He needs to hit *6. I think he's on a phone.
Okay. And while he's working on that, who have I not named to come and do an introduction? Could I invite you to unmute now and introduce yourself?
Hello, everyone. My name is Natalie Hernandez. I am an AmeriCorps Vista working at the DuPage Health Coalition. So I work with Kara Murphy, who gave the introduction of our organization. I'm very excited to be a part of this and learning and to learn a lot from everyone.
Good, welcome. Thank you for being with us. And I want to check back with you, Michael, once more, and we're going to give you that chance at some point if we're not able to get you unmuted now, but when we get that figured out. And let me invite Linda Yang. Looks like Linda's coming into audio now. Hello, Linda. Would you mind introducing yourself, name, organization, what you do, and why this group is important to you?
Okay. Good morning, everyone. This is Linda Yang, and I'm Executive Director of Shilin Association. We are a social nonprofit organization, and also we are in, mainly our headquarters is in DuPage County, but we are serving 5 counties like Suburban Cook, Lake, Will, and King, and the city of Chicago also. Our mission is to helping to promoting the healthy transition, and from a very beginning, we were helping healthy transition the immigrants, Chinese immigrants to the society. But later on, we expanded to Asian, and now we are serving more populations. So our program, we are emphasized on the senior services, health, and well-being of the community members, and also we have children's program. We have performing arts program. So it's a kind of a blended and exciting program. So we have been in DuPage County since 1992. So it is, any questions?
No, thank you, Linda. Appreciate that so very much. Thank you for being here. And to all of you, thank you for coming and for beginning that relationship building. So when this meeting started, I didn't know most of you. Now I know all of you, at least some, and that's something to build on. We now are going to be going into a portion of the meeting that is going to feature presentations. And those presentations are going to spur questions and comments from the group. And we're small enough that I think we can just kind of manage this with ourselves. And with our presenters, I will ask you also to take some lead to say to those folks who are raising questions or comments in real time, would you like them to hold off until you are complete, or are you ready to receive those? Just kind of manage them as we go through. I'll manage our time as we do that, but I think this group will work well enough together that we can be kind of informal in that way. So now let me introduce you, or invite to the mic, Karen Ayala, Executive Director, DuPage County Health Department, to provide our call to action.
Thank you so much. I am very excited to be with you this morning, and I appreciate the diversity in the constellation of participants that we have on the call this morning. Mila did not give herself nearly enough credit. We at the health department have been, as you can imagine, pretty busy with COVID, and Mila has really helped shepherd our efforts along with Penny to create the logistics that are necessary to be able to pull off this type of a meeting and a call. And so lots of thanks and appreciation to Mila and Penny for doing that. With that, I think the diversity that we bring to this group is exactly what we need in order to address it. It is not simply in order to reduce the disproportionate burden of COVID-19 among our populations at risk, at increased risk for infection, severe illness, and death. We must really employ a multi-pronged, creative, never done before kind of strategy. The other piece that we have to address is to broadly address the health disparities and inequities related to COVID-19 with a health and all policies approach. We know from the start of this epidemic that one of the challenges of getting people to stay home when they were sick were around workplace policies and not having paid sick leave and those kinds of things. And so we know we must incorporate and really lean on our business partners to help us address that and come up with creative solutions. And finally, I think a cultural difference that we have within the fabric of DuPage County is that I'm not interested, certainly, and I would imagine that most of you sitting around on this call this morning are not interested in simply talking about the issue, wringing our hands, and pontificating on ideas. Rather, we want to move our group to action. And we want to have not only action, but we want to be able to demonstrate that. And so by developing a strategic plan with metrics, we want to really be focused on being able to measure our progress, to identify opportunities for progress, and then move us forward. We know that reducing the disproportionate burden of COVID-19 is not going to happen next week or next month. It will require a great deal of effort. And once COVID-19, although it's hard to even imagine now, is in our rearview mirror, many of the strategies that we will have put in place will continue to reap benefits. So our call to action, again, is threefold. I invite you on this journey. And with that, back to you, Dave.
Thanks, Karen. Now let me invite to the mic Dr. Rashmi Chug, Medical Director, DuPage County Health Department.
Thank you. Good morning. And Penny, will you be sharing my slides or should I be sharing my slides?
You tell me what you're most comfortable with and I can do it, or whatever you'd like.
If I can do it, I'll go ahead. Let's see.
It's at the bottom on the toolbar, share screen.
One second, let me try again.
And if not, I can do it for you.
Try one more time. Yeah, if you could please, I'm not seeing it. Sorry
Sure.
about that.
No, no
Thank you.
problem. Let me just pull it up here.
Oh, I do see it. Sorry. Should I?
Well,
Either way. Okay, we're good. This is great.
Are you good? Okay, hold on. Let me pull it up so that it's in full view here.
Thank you.
Okay. I don't know why it went over here. Hold on, I've got two screens going here. Can you work with this, Rashmi, or do we need it bigger?
I will for some of the graphs.
Okay, it's not, I don't know why it went over on my second screen here.
Do you want to end the slideshow? And
okay, hold on a second here.
Sorry, folks. We'll have this going in about 30 seconds.
I just don't know why it. Okay, let me stop share here. Can everyone see that?
Yes.
Yes.
For whatever reason, it doesn't want to go into the slideshow.
Okay. I think as long as folks can see it, I can proceed.
Go ahead, Rashmi.
Okay, thank you.
I'll continue to see if I can get it more full screen for you, but it
All
keeps
right.
sliding over onto my other screen.
All right, very good. Well, thank you and good morning, everyone. Again, my name is Rashmi Chug and I serve as medical officer at the DuPage County Health Department. And as I think the groundwork has been laid so beautifully, really, and as Karen just outlined, the many aspects that are so poignantly evident now that we really need to address. We want to make sure that we're not only addressing it with our hearts, so to speak, but objectively, and making sure that we're quantitatively and objectively assessing the need and the gaps, and then also monitoring the impact of any intervention that we do, whether it's hopefully progress, but also any unintended consequences, and how, so that we essentially have data-driven action that's informing our interventions. So if you could please move to the next slide, Penny. So our first question is really, why are we here? Why is this necessary? And what came to my mind was really two reasons. Basically, what gets measured gets done. It's very important to not only describe the problem, to be able to tackle it quantitatively particularly, but also, oh, perfect, thank you, Penny. So we want to be able to measure the various indicators that are manifesting our impact, and then also, toward a goal. So what gets measured gets done. It provides us information to help inform us make decisions to improve our results and our outcomes, more specifically health outcomes, again, toward data-driven action. And then also what struck me was really, it's sort of more in the area of research, but it can apply to society at large, the Hawthorne effect, which is the alteration of behavior by subjects of a study or even individuals in a community due to their awareness of being observed. Now, this can have a positive or a negative effect. If someone is being observed from, say, an undesired aspect, then it may not have the intended consequence, or it may have the intended consequence, but really it can be a deterrent to improve behavior, but it can help improve behaviors. And it can also help draw attention to, again, gaps and needs that are sorely needed. So I think definitely, as we know, we basically need to, and it also helps us, I think, build credibility in our efforts, and hopefully some funding support as well. So so it's very necessary, like we said, to get things done, and also to help positively influence our behavior individually and as a community. And next slide, please. So why is this urgent? Why are we a response team? Well, unfortunately and tragically, COVID-19 in a matter of months has become the third leading cause of death in the United States, only after heart disease and cancer. And it's unfathomable to think that just, since earlier this year, this virus, SARS-CoV-2 virus, has led to so much death and illness. And really, at an individual level, our community members are dying prematurely. We have so much, I think most of us either, know someone near and dear to us, or in our circle, professionally, personally, who has either suffered illness or infection, or has been individually impacted in a devastating way. Dr. Perez mentioned from a behavioral health perspective, I think certainly all of us have impacted. Look at us, we're here in a Zoom meeting instead of gathered physically around a table, we're, around the virtual table, which is, such a privilege to be able to continue this level of engagement when it's so necessary. But look at how dramatically it's changed all of our lives. So, but most poignantly, tragically, it has led to the premature death of so many of our, well over 500, over 600 now, of our DuPage County residents and community members. So we must act. Next slide, please. So what is our opportunity? I thought while we're talking about health equity, we want to make sure we are clear in our understanding of the difference between equality versus equity. And I thought these images really explain it nicely. And if you'll indulge me, I'll just talk through them. So you'll see to the left, we have 3 individuals of varying height and ability, where in the first image, they're each given a box to stand on, or a crate to stand on, that is of the same height. So it's assumed that everyone will benefit from the same supports. They are being treated equally. In the next image, the individuals are given different supports to make it possible for them to have equal access to the game. They are being treated equitably. So certainly we want to make sure we're viewing and acting through an equity lens and not just equality. Now in the third image, all 3 individuals can see the game without any supports or accommodations because the cause of the inequity was addressed. The systemic barrier has been removed, which ultimately is our goal, to remove any systemic barriers to health equity and access. And there is still a fence there for their safety, but certainly we want to make sure that we are doing everything we can to remove barriers toward improving and achieving health equity. Next slide, please. So let's dive right in. I'll walk through these slides, and Dave, thank you for the cue. I think we'll try to move along, but I think sometimes it's easier if we take questions on any specific graph as we go. So starting with ethnicity, and we'll kind of go through a progression of looking at case rates, then hospitalization rates, and then mortality rates. So here we have the case rates by ethnicity for DuPage County residents. And this covers the duration of our local experience with the pandemic. So really since March, this captures all of our cases. And these graphs were developed this week. So you'll see here on the left is the case rate for Hispanic or Latino cases, individuals with COVID-19 infection, followed by the non-Hispanic or Latino case rate, and then the DuPage County overall. And I did want to just draw to your attention that our overall case rates for all graphs by ethnicity and race do include a large portion of cases for whom ethnicity and or race were unknown status, or were entered as unknown status. So so unfortunately, it's a significant proportion that can impact our data, and that's another reason we need to continue to advocate for complete and quality data. But it's actually over. It's certainly over a quarter of our cases. But so looking at our first graph here, I mean, it's so evident that the case rate among our Hispanic or Latino population is significantly higher and disproportionately higher than our non-Hispanic counterparts. So the COVID-19, and you'll see in the text box here, we have a little bit of interpretation that the case rate for Hispanic or Latino DuPage County residents is 3.2 times higher than that of non-Hispanic or Latino DuPage County residents. So again, this is just to kind of lay the groundwork. This is baseline data and some metrics that we've identified, and these have been available on our dashboard for a few months now. But in case you're not aware of them, we wanted to make sure that you are that we can review them in detail in this forum. Next slide, please. Actually, I'll pause for a second. Any questions on this one? All right, let's move to the next slide. So this shows our case rates by age group, by ethnicity. So here we have broken down by decade of age. We see that across all age groups, the COVID-19 case rate is higher among Hispanic or Latino DuPage County residents compared to non-Hispanic or Latino DuPage County residents. Again, it's undeniable that, that our Latinx population is just so significantly and disproportionately impacted from a case perspective. When you look at least across the distribution of individuals who have been infected with COVID-19. So now, next slide, please, we'll look at hospitalizations. So here we have that the COVID-19 hospitalization rate among Hispanic or Latino DuPage County residents is 2.8 times higher than that of non-Hispanic or Latino DuPage County residents. So almost as previously it was more than 3 times, but even still with a more severe outcome of hospitalizations, we're almost 3 times as high as our non-Hispanic or Latino population. So that's for hospitalization. And then we move to mortality. And this is kind of deceiving in a way because, and I'll show you why in a moment. So here it looks like the overall mortality rate for our Hispanic or Latino individuals with COVID-19 who tragically died. It says that the mortality rate is actually lower than our non-Hispanic counterparts. So it's the COVID-19 mortality rate is 1.1 times higher among non-Hispanic or Latino DuPage County residents compared to Hispanic or Latino DuPage County residents. Now, this is a graph that we've been updating on a weekly basis on our dashboard, but just in recent days, it's just emphasize the importance and underscore the importance of really diving into our data, which we've been trying to do progressively, but for a variety of reasons have, and in part driven by this forum coming together, have had the opportunity to, thanks to our epidemiology team, dive in more deeply. So if you could go to the next slide, please, Penny. This is our breakdown by age group. And you'll see here that although the overall COVID-19 mortality rate is lower among Hispanic or Latino DuPage County residents that we just saw, when reviewed by separate age group categories, the COVID-19 mortality rate is higher among DuPage or Hispanic or Latino DuPage County residents across all age groups. So it's actually the inverse, and quite significantly. The apparent discrepancy between aggregate mortality rates versus, or the aggregate mortality rate that we just looked at in the last graph versus comparison by age group may be explained by the Hispanic or Latino population in DuPage County skewing younger. For example, 40% of the Hispanic or Latino population is under 20 years old versus 25% of the non-Hispanic or Latino population being under 20 years old. So that combination of factors contributed to this. I mean, both can be true, but what a misperception there may be by only looking at the aggregate rate, the aggregate mortality rate. So just wanted to show here that in fact, across the board, and even though, I mean, thankfully our mortality rate is relatively low in our younger age groups, but tragically, we have had several deaths in individuals between 20 to 49. I mean, across the board, it's just been, you know, I mean, every year, I mean, every day when we go through our counts, it's just with a heavy heart that we review not only the burden of disease, but the individual deaths that have been reported. So, so really even here, so much is represented here that that isn't completely told, but it's evident even in the 20 to 49-year-old age group where we had, and we combined it because some of the sample size, some of the numbers and some of the counts in each category were too low to calculate a meaningful rate, which is a good thing. We want it lower, you know, we want none in those, but as far as calculating rates, we had to combine age groups to arrive at a sound rate. But it's even evident when you look at the numbers that, you know, the Hispanic mortality rate for the 20 to 49-year-old age group is 22.4 versus 3.2 for our non-Hispanic population of COVID-19 cases who died tragically. And then the overall DuPage County mortality rate is 6.2. And then, you know, significantly progressing onward for the 50 to 59-year-old age group, and then the 60 to 69-year-olds, and then the 70 to 79-year-olds, and then so significantly in the 80 plus. And then just for additional clarity, these rates are a calculation of the number of, for example, in the 80 plus year old, or in the 80 plus age group, it's the number of, the blue bar represents a number of persons 80 or older who were Hispanic and who had COVID-19 infection who tragically died, over the number of Hispanic persons in their 80s in DuPage County, times 100,000 for population. So that's part of the breakdown that occurs when we're looking at data by not only ethnicity, but by age group. So I'll pause for a moment because I think this is kind of a revealing graph, but does anyone have any questions here?
Dr. Chu, this is Jan Guider.
Yes.
I'm looking at this data wondering, do we understand or know the why? For example, in age group 50 to 59, I'm assuming that the comorbidity rates were higher, specifically with diabetes in that age group. And then when I'm looking at the age group 20 to 49, I'm assuming that this is a group of people who are now deemed essential workers. So they have a greater exposure to this contagion, and because they're working in industries where they may not have the luxury of physical distancing. Are you finding anything that's standing out to explain the why? And one other quick question, are we measuring or are we considering what the health literacy is for this population? Thank you.
Thank you for all of those questions. I think they're all excellent points. And I would say anecdotally, we are finding those, I mean, on an individual basis, but we have not yet been able to delve into our case data to that level of granularity, partly because there have been some data completeness challenges, and we're working on addressing those so that we have a better set of complete data that can be queried. But you're right, at a population level, we certainly know of, increased rates of different chronic diseases and comorbid conditions and different socioeconomic factors that definitely factor in. So I think that's also a large reason of why we all need to be working together to address these inequities. So, so I think everything you said is true, and reasons that we need to study this deeper. Thank you for the questions. And if we could move to the next slide, please. So now we'll look at race by case, hospitalization, and mortality. So here are our case rates broken down by race. And we have here that our COVID-19 case rate among Black DuPage County residents is 1.5 times higher than that of white DuPage County residents and 1.8 times higher than Asian DuPage County residents. So we have here, again, significant fluctuation and disparities in our rates by race. And so our next graph shows the breakdown by race and age group. So Penny, if we could move to that, please. So here you'll see across all age groups except those 10 to 19 years, the COVID-19 case rate is higher among Black DuPage County residents compared to white and Asian DuPage County residents. So you'll see here again that especially in our elderly, but the disparities are quite evident in the case rates. So again, this is persons with infection. So hopefully mild, maybe even asymptomatic, but also includes our most severe outcomes of hospitalizations and death. But then if we go to the next slide and look at our hospitalization rates, we have the COVID-19 hospitalization rate among Black DuPage County residents is 2.1 times higher than that of white DuPage County residents and 2.1 times higher than our Asian DuPage County residents. So again, just very evident even with progressing severity of outcomes. And then we'll go to our last slide here on race, which is mortality rates by race. And so this one has 2 points to it. And one is that the COVID-19 mortality rate for Black DuPage County residents was 1.4 times higher than for white DuPage County residents and 1.9 times higher than for Asian DuPage County residents. So here, again, it's very evident. We have in the first set of graphs, ethnic disparities, and here we very much have racial disparities. The second bullet point shows, and we didn't do the breakdown by age because the only sample size that showed a different trend is reflected in the second bullet point here, that the COVID-19 mortality rate for Asian DuPage County residents aged 50 to 59 years is 2.8 times higher than the DuPage County overall rate for that age group. So for some reason, there was a cluster of individuals who were of Asian descent or Asian DuPage County residents in that age group in their 50s who had a much higher mortality rate than they were the highest, the leading, compared to the overall DuPage County rate. And that was an aberration from the pattern in other age groups. So just wanted to call that out because we don't understand why yet. And these are all just, again, laying the groundwork for our baseline understanding of what metrics we currently have and where we want to delve deeper. So that might be the last graph. Can we move to the next slide, please? Yes, so again, like I said, so we're not going to be able to address this now, but I think as we move forward, wanted to make sure that we are keeping these questions in mind, that what else would you like to measure and monitor? What else, and Jan, thank you for your questions, because I think we'll need to include, definitely want to include those. What do we already have access to, which I'll talk about in a moment. So what I'll talk about is impact due page in a moment, but also be thinking about what you in your capacity, personally, professionally, already have access to, you know, which data sets, which metrics and indicators are you already tracking? And then which data are feasible to collect towards surveillance? Because I think we certainly have a lot, if that's something that we need to consider often, that there's so much that we want to look at, but really what is feasible and what are, how can we identify the most complete and high quality data sets to reach accurate, to have accurate findings. And if we can move to the next slide, please. So as I mentioned, Impact to Page is our countywide initiative with partners, community partners and leaders from all sectors, and it was established in 2013, really focused on improving the collective goal of improving the well-being of DuPage County residents. Next slide, please. So there's already a lot of work being done to help address work disparities, and already many, look, 100+ indicators on DuPage County, on Impact DuPage's community data dashboard. It's a very rich dashboard with many indicators, and there are many within those that are stratified by race and ethnicity. And there is an action plan to reduce chronic disease and access to care, reduce chronic disease and improve access to care. Reduce chronic disease and access to care disparities in the Latinx population. So definitely an identified priority, but here I think, especially with the exacerbation of many of the existing inequities that we're experiencing, we have an opportunity to address those. And I think short term, we want to be doing those very much through the networking of our our health equity and access response team. And then over time, we can continue to bolster the work through Impact DuPage. And the information is available here at, or for further information at impactdupage.org. And with that, I'll turn it back over to, and sorry, I think unless there are any other questions, I know we want to move along and have enough time for discussion. So I'll turn it back over to Dave.
I have a question.
Oh, yes.
Is there a way to break down those numbers by income?
Certainly for populations, we don't have income data on our cases at an individual level, but we could, we have been discussing how we can perhaps, you know, with different overlays to be able to understand, or at a more granular level, be able to understand case data within either specific geographic areas or, you know, to be able to incorporate or even by occupation. We are looking at seeing if we can at least analyze by occupation. So
Okay.
some SES factors we are looking at incorporating in case analysis.
Because I suspect that a lot of this, especially the morbidity rate, is due to haves and have-nots, those that have access to resources and health care will probably have less of an impact. And I'm not saying that they won't get it, but they probably will survive. And that's only a theory of mine, versus the poor or the people that lack resources. And and I guess that way we can go back and definitively, or at least expand our thought process and say, hey, these people, it's the poor that's dying versus the affluent.
Yes, thank you for that. And we definitely want to look at it from a socioeconomic perspective. But I will say something we're already observing is that we're seeing, again, anecdotally, just in some of the review cases and deaths that we review, that sometimes, especially in the younger individuals, that there's sort of two courses that they take, since you were speaking of access, and they may have access, but it might be too late. And so we're seeing some who develop infection and are identified and then, admitted to the hospital and progress to the ICU and then have a prolonged illness and hospitalization for over a month and then tragically pass away. And then there have been some recently that we've seen where they've had illness for about 2 weeks, but then the ambulance is called. And I mean, tragically, in one instance, the individual arrested right there was resuscitated and then taken to the emergency department, but then sadly expired. And so they they weren't able to access care soon enough where it could potentially help reverse their course of illness. And I think that could have a lot to do, and likely does play into overall access and outcomes.
I agree, because I think that for many people that lack means and resources, their only means of health care is the emergency room. They don't go to doctors, they don't seek out physicals, they don't get tested as they should until, like you said, until it's too late. And then it's, but it's just a food for thought.
Definitely. Thank you.
Dr. Chu, if I might add, Jan Geider again.
Yes.
If we could get data, demographics by occupation, I think that, Karen spoke about health and all policies. That would definitely inform how and what policies we need to protect those who are not in a position to protect themselves.
Yes, 100% agree. And we are working to, we actually have some dedicated staff who are working on data entry, helping to improve the quality of our data in our data set so that we can then have not only a more robust database, but then be able to easily query and run reports that reflect occupation within different levels of illness and severity. So absolutely, we're working on it. But thank you, excellent thought. Thank you, everyone. Dave, back to you. Yes.
I was going to add, I don't want to break into someone else's question. Member Selman, were you going to ask? Okay, we have a chat question from Saima Asfar regarding data on Arab Americans, and are Sudanese considered as African American in the data?
Well, because it's not necessarily considered by nationality. It really depends on how they're entered. So it's very individual specific, or it's entered at an individual level. So it might be how the individual identifies themselves, or if they're not able to, if they're so ill that they're not able to complete the information, then it might be how their healthcare provider identifies them and enters the data.
And then her question about Arab Americans.
Yeah, good question. And same, I think it would depend on how how each population enters themselves. So I suspect it might be, I don't know if it would be under Asian or, I don't know. I'll have to look into that. Yes.
Thank you so much, David. So actually, sometimes Arabs are considered as white, Caucasian, and we have, pockets of refugees, Syrian refugees in DuPage County, Sudanese and others, and I'm not sure if they are counted in the county database. So I don't know if it should be looked into it. We should look into it because it's very important.
Yes, and I would be interested in knowing if you have any data sets, if you're any information or knowledge that you can share on how they're currently being tracked or how you recommend they be better counted and tracked. That would be helpful. Sure. And we can certainly connect afterwards as well. Thank you. Excellent point.
Thank you.
Another chat question from Nicole Edmonds. What about the quote other population? How is this included in the data?
Yes, let me find one of the footnotes. So let's see. I do know that we have other, and it's other includes 2 or more races or unknown, or I know there is, it's a relatively smaller number, but the total of categories that are included in other ends up being, then when you add unknown to that, it adds up to significantly more, but there are different categories within there. Like I said, 2 or someone, if they identify, well, many people will identify as other also. So it is its own category. And then, like I said, 2 or more, or yeah, unknown is separate from other, but yes, other is when someone doesn't identify with some of the categories provided, and then they'll self-select other. And I see one more. Oh, Member Selman, are we collecting data when possible, of course, about which language is spoken at home? I wonder if we're missing some populations. I'm thinking specifically of Polish-speaking households, despite having so much of our info in English and Spanish. So I believe in the case report form, it's not necessarily asking about if I know we are tracking in the interview management tool, there is a field or a few fields, I think, that would reflect if an interpreter was necessary. So I think that might be one proxy we could potentially look at for people who for whom English is not their primary language. Good question.
So Dr. Chug, this is what I'm thinking of. This has been a fantastic discussion, and we want to figure out how we pull this information together. And I can tell it's probably provoking questions and concerns and thoughts and comments and others. I'm going to suggest as one of our action steps at the close of this meeting that every member of the group take that question or concern or consideration of yours and write it into us. Write it down so that it reflects exactly what you're interested in. And the question, Dr. Chug, is where those should be directed to. Do you think that would come to you? Would that come to Mila?
Yeah, if I may ask Mila, if that would be all right, or maybe even Penny, if Penny, just since everyone has Penny's point of contact, because we're all very connected here, and I want to do everything I can to not miss it in my email box at this time, just because I know the volume is very high for many of us. But Penny, if they could please be sent to Penny, that would be really helpful.
All right.
Penny, is that all right, as I volunteer you?
Sure, that's fine.
So
thank you very much.
You're welcome.
As we come to our close, Dr. Chug put 3 key questions up there that we were going to ask you to take with you and mull on and bring us feedback back. As you can tell from what you heard, this is really good feedback. That's exactly why we're here today, and we want to keep that going. I'm also conscious of our time, and so I want to make sure that we get a chance to present the framework that's been proposed and the need and urgency for some immediate actions to happen. So at this point, I want to invite to the microphone Kara Murphy, President of DuPage Health Coalition, to talk about the proposed framework.
Good morning, everybody. And I want to acknowledge that there's no piece of the conversation that we just had that isn't exactly why we're here. So we're a little bit off timing in terms of what we wanted to be able to get through today, but that's really because this is such a robust conversation and one that's overdue. So my thinking is that I am going to try to truncate my description of the framework so that we can permit a few minutes at the end for next steps, recognizing that we're going to, in our subsequent meetings, A, want to delve more deeply, and B, also collect feedback from folks about what is present and what is missing in the framework that we've already created. It is not an accident. Everybody received this framework by email. This is very much a work in progress. It says draft on it for a reason. It's much easier to have something against which people can respond than to bring together a new group and ask them to create something from scratch. But we expect that this will evolve and change. That's exactly as it should be. And so just as we envision this as a partnership, that we want it to be a county-wide voice for health equity, and we really want ownership within all of the different pieces and parts of this group on making certain that the final framework and the projects and strategies that we promote reflect all of the different wisdom and voices in the room. The other thing I want to say is that the membership of this group is still in draft form. So I know that everyone that's on this conversation is meant to be on this conversation, but one of the things we'll also need to hear from the group about is who isn't present. Which voices do we need to bring into the conversation? There's a healthy tension. You could have this group be 300 people wide. It would certainly create a more rich dialogue, but it would also probably challenge our ability to interact meaningfully with each other. So we're going to try to figure out how to be nimble and small, but also make certain that all of the different voices that should be represented are, and your feedback about what's missing would be really helpful. Effectively, what you're looking at with that several-page document that we shared is a number of strategies that we have launched for people's reaction and feedback around sort of the goals of this health equity and access response team and around this partnership. And strategy one is really this place where we've had this robust dialogue over the course of the last 30 minutes or so. It's around expanding the evidence base. We are lucky here in DuPage County to have a great team between Dr. Chug and the epidemiologists and the healthcare professionals collecting and sharing a lot of data, but we don't have all of the information we need. And some of the questions that were posed today really highlight the places where we know the right questions to ask, but don't yet have the answers to those questions. It also means that data is not just what you can collect on a spreadsheet, but also the conversations, the relational engagements that you have with the community. So strategy one is around expanding the evidence base and looking at qualitative data as well as quantitative data, using our community leaders and their feedback and their connections to the communities with whom they work to better inform both the questions we ask and the answers to those questions. And then also looking for places where we could be more robust in our data collection and using contact tracing and some of the other strategies that have an interventional or clinical component also to aid our fund of knowledge and learn more about how we can start to change the tide on some of these disparate outcomes. The second strategy is around expanding programs and practices for testing, contact tracing, isolation and quarantine, vaccination, healthcare, and also recovery, as well as addressing the impact of unintentional negative consequences of mitigation strategies. This is a big, wide net, and there's been an awful lot of sort of discrete work that's been happening over the course of the last 9 months on some of the elements of this, like PPE initiatives that are increasing access to PPE for vulnerable populations, for healthcare agencies, partnerships with F2HCs and food pantries, places of worship, procurement distribution of PPE. The DuPage Health Coalition has been involved in some of those efforts. NAACP, I know, has been doing work distributing thousands of safety kits. I know Village of Addison is doing this. Many of the food insecurity events are also providing distribution of PPE. And the health department and CARES Act dollars have also helped to support a number of those initiatives. More needs to be done. Testing, treatment, and vaccination access is another piece of strategy too. Making certain that our Testing resources are low barrier, that they are co-located in communities where people need easy access to treatment, that people have appropriate education around treatment and when testing is appropriate and how to access testing. We've seen a number of our F2HC partners that have initiated mobile testing or on-site testing in the communities that they serve. And of course, we're all aware of the county's efforts testing 600 individuals at the fairgrounds every day, 5 days a week, and expanding that service through December. Communication and education is also a huge piece of this strategy, and a place where we recognize that there's actually quite a bit more work, I think, to do, that messages need to be tailored to specific communities and specific concerns, and that we need to do a better job of identifying questions or areas of knowledge gap, and also making certain that we're acknowledging people's fears, concerns, stigmatizing conditions, whatever the case may be, that are preventing them from being able to get speedy access to treatment and recovery services, as well as testing, as well as PPE, et cetera. And then it's really about collaborating amongst our networks, not just of healthcare providers, but human service providers, social service and crisis-related providers, making certain that we're really developing a well-knit network that ensures that no one falls through the cracks. Strategy 3 is around expanding program and practice activities, supporting essential and frontline workers who are at greater risk for exposure to, contracting of, and unfortunately having negative outcomes as a consequence of COVID-19. Both those individuals who are frontline workers providing clinical care, but also individuals who are essential workers whose families are dependent on that income, who don't have the privilege of being able to work on a Zoom call every day, but rather have to engage with the public and are presented with circumstances that may result in higher disease burden or higher likelihood of transmission. And so we really need to be able to be very practical, thoughtful, and sensitive to the fact that there are communities that are naturally at greater risk, that there are populations and workers that are at greater risk, and what are we going to do about that? We talked about capacity for PPE and testing. I want to just address vaccination a little bit. It crosses into a number of these categories. We've been doing a lot of work right now on flu vaccination initiatives with funding from the county to support that, but mindful all the while that the end point of getting everyone vaccinated for the flu is a quality outcome in and of itself. But it's also a proving ground for the idea that what will be coming down the pike, we hope, is access to vaccination services for COVID-19. And we need to be able to refine and increase the efficacy of our efforts to connect with all populations around vaccination. And I think many of us are mindful as we work through the oncoming flu season that we're also learning valuable lessons that we will apply to COVID-19 vaccination, also to ensure equitable distribution of vaccine when it becomes available. The last strategy is around expanding an inclusive workforce with advocates and representatives equipped to assess and address the needs of a diverse DuPage County workforce. And that's really becoming more culturally and linguistically competent, developing teams that can nimbly address issues related to COVID-19 in the workplace, building capacities among businesses to enact policy change and support health equity, and then using funding and initiatives to address it in communities and populations disproportionately impacted. The last is to recruit and hire individuals for COVID response from the populations who are themselves experiencing disproportionate impact, recognizing that that will be a powerful force for us to be able to engage communities and support them through the pandemic. We could probably spend about 30 more minutes detailing some of the pieces and parts of this, strategic focus, but hopefully that provides the beginning of an overview. And what I'd really invite people to do is to look through and think about where they have particular interest in some of the strategies that are being discussed, where they have feedback about how we might refine that strategy, or places where, in the absence of appropriate planning, we might fall short of our aims. That sort of feedback provided back to this group will allow us to continue to refine this document so that it really does become a good toolkit for us to enable the kind of change that we're trying to build. With that, I'm actually going to turn it over to Chris to talk a little bit about some opportunities for funding and maybe also a timeline.
Thanks, Kara. Yeah, and I will go very quickly, recognizing.
Can I ask a quick question?
Yeah.
Sure.
What is the time of day when a person can go in and get tested? I know you mentioned that it was 5 days a week. What's the time?
So the test site that we run in Wheaton through DuPage County is 7 a.m. to noon, Monday through Friday.
Okay.
And I'll put a link to the page there.
Okay.
In the
And
chat.
real Chris, VNA and Hamdard offer opportunities in the afternoon and DNA in the evening. I think that those are not as well understood by the community, so I want to acknowledge that. The goal has been to try to expand access across the waking hours of the day, but I'm not sure that people are always aware that there are evening opportunities, for example, at VNA.
Can you put that in the chat?
Yep, I sure can.
And Michael, in follow-up to this meeting, we'll send a brief with the testing opportunities so that you have a kind of a comprehensive look. We'll draw that. The DuPage County Health Department website has a really nice page listing those options, and we'll make sure that gets out to folks right after this meeting is over.
Excellent. Thank you.
Okay, briefly on opportunities for funding and timeline, that is one of the important elements for bringing a group of folks like you together, is to help inform some of the projects that we feel could make a substantial impact on our community. And despite the significant impact of COVID, there have been significant opportunities as well. And so we know the CARES Act funding at the federal level. We know there's multiple philanthropic efforts to raise funding to support individuals and communities. The framework that Kara shared and reviewed is our opportunity to outline the work that we think needs to be done, but very tangibly, we will likely have the opportunity to direct or to help community organizations and partners identify resources for things very tangibly like face masks. We know face masks are a very important, simple way that we can address the ongoing spread of transmission. We should not have a situation in DuPage County where somebody cannot wear a face mask because they don't have one. So we've distributed thousands of face masks. DuPage Health Coalition has led a very significant role with Access DuPage and making sure that people have access. We've worked with municipalities through the health department. We would love to work with any community group to distribute those. We have an ongoing effort to distribute safety kits. Mila, I think, is going to hold one up. Yeah, that's the face mask. And then we have some sweet fanny packs that include hand sanitizer and backpacks to carry it all around with you. So those are very simple, tangible things, but so critical. Everybody wants a silver bullet. A face mask is a pretty simple way to help people protect themselves and those around them. So if you have recommendations on where those need to be distributed, who doesn't have access, where can we target? It's a very simple, tangible thing that we can direct resources towards. On a more longer term basis, we're interested in both the health literacy component, helping people understand how to make decisions about when do I need to be tested or where can I be tested, making sure that people have access to testing. We have the opportunity to direct both CARES Act funding and other supports to individuals to help them both protect themselves and respond to COVID. If you have ideas, recommendations, thoughts on where funds could be best directed to support our communities to safely respond to COVID, those two, please send them to Penny. I'm going to volunteer, Penny. Thank you. But if you have, both very tangible things, we need more face masks or we need testing access in this community. We're looking for you to help relay those requests, both from your own knowledge or from the clients or partners you work with. And if you have more longer term substantial recommendations, we hope that the framework gives us an opportunity to take those to funders to say, this is what our community needs. We have both the data to back it up and a plan to use those resources. So we're looking for input from you there to help build that process. So I'm going to stop there. We had planned to spend a little bit more time there, but I'm just going to pitch to you a request. If you have recommendations on things that communities need or suggestions for projects or pilot projects you think would help, please bring those forward, and that will be part of our ongoing discussion. And in terms of timeline, Dave, I'll turn it back to you.
All right. Thank you, Chris. So to all of our presenters, thank you for the accordion adjusting that you've done for us to be able to meet this timeline. What we've done today is taken a really important step forward, and I hope that you agree with me that this is a really good thing for us to be doing. And we've advanced our understanding of what's going on in the community, the impact and the disproportionality of it. And hopefully we've engaged all of us in thinking about how to make this better. The first timeline issue that I want to address is our coming back together again. And I'm going to suggest to the group that we return together 2 weeks from today, 2 weeks from this morning. And I'm looking at my colleagues in the planning of this event. Does that match your sense of the frequency with which we anticipated? All righty, good. I see the thumbs up. So that's what I'm going to suggest, that we'll come back together again in 2 weeks. But in the meantime, today you've had 4 requests made of you, and we'll put these into writing and we'll distribute these to you, but I want to recap them right now. The first is, now that you understand what this is about and who's here, who's missing, who should we have in this conversation that's not here? Think about that and we'll give you a place to submit that recommendation. Number 2, regarding engaging data. Today we learned a lot of things about things we'd like to know. Keep engaging that data and think about what, actually Dr. Chug has given 3 specific questions to us. What else should we be measuring? What do we already have that we should get into the mix of understanding? And what other data for surveillance is feasible for us? The third thing is to engage that framework. As Kara has presented it, you have a written copy of it. We'd love to hear from you where you see you fit, in what places, and where you would like to step forward and move things further. And then finally, with Chris's presentation, we're asking specifically, where are you doing things that you have requests of us for the kits, the PPE, or other things that will help enhance what you're doing? Or where are you already moving toward equity and engagement with the community, but you've got additional needs, things, ideas, projects that could be done? Thanks to the National CARES Act, thanks to the DuPage County Board, there are funds available to support that. So we need to hear back from you what you think you need to build on what's already going well for you. So in closing, what I want to say is how grateful we are that all of you have taken this time and this commitment this morning to advance equity in DuPage County. Thanks so much for engagement with this meeting. Thanks for what is going to come. Let me check with my colleagues in the organizing of this meeting. Is there anything else that we should address before we bring this to adjournment?
Hey,
David. David, this is Penny. I just wanted to say the health department staff, Chris, I don't know if you saw it. I think 2 weeks, we have a HOPE task force meeting. So I just want to make sure that maybe we mention that now before you confirm that as a date.
All right, so it's not firm. We will come up with a date and it will have some immediacy, some urgency to it, but we'll make sure that it's correlated well.
And David's Mila, I was just going to say that maybe we'll send out an opportunity on specific feedback items we'd like ahead of those meetings, so we can keep moving along. And as you mentioned, those 3 questions will be woven in there too.
Right. All of those tasks that we're asking of you would be things we'd be looking for quick responses so that we can weave them into an agenda for the next meeting, as opposed to waiting for the next meeting to hear back from you. Okay, well, thanks so much. Thank you to the DuPage County Health Department staff for putting this together. And here we go. So the inaugural meeting of the Health Equity